Hello, how are you? I'm hoping everyone is okay. Please stay safe, stay at home. I know it's very difficult time for chronic pain patients and for everyone indeed, but I am here to look after my chronic pain patients. So today the topic I'm going to speak about is patients who have knee pain problems and the effects or the relationship with COVID-19 and morphine patches. As you know, many of people in the community, they have actually chronic joint pain. I'm talking specifically to elderly population who are in their 70s and 80s. So many of you will have some morphine patches in place. The thing that I need to advise all of you and to warn all of you against is if you have high temperature, and this could be because of the normal flu or because of the COVID-19, please mind the fact that when you have a high temperature, there is an increased absorption of the morphine through the skin to the system. So patients who have patches and the spike temperature because of the current pandemic of COVID-19, they will be probably at higher risk to have an overdosed morphine. This doesn't mean that you take off your patches immediately, because if you do that, you will go into withdrawal symptoms as well. But what I meant to say is to take care and to monitor. If you have any symptoms of COVID-19 or you started to have temperature while you are wearing these morphine patches, please contact your GP and get a medical advice regarding what to do. And you need to be monitored by someone who can see if there is any signs of increased absorption of this morphine in the body. So the overdose symptoms and signs from having morphine patches, if it's there is an increase in absorption, will be you will feel that you are more drowsy, you are more forgetful, you started to be more sleepy, more tired, and you will feel probably more sweaty. The problem with the temperature with morphine patches is that the temperature itself or the fever can actually make you more sweaty, and the patches can be not sticky at this time. So we need to be mindful about all these facts and to watch yourself if you have high temperature, that these are the things that you might struggle with. And you need, of course, with your carer and your medical advisor to always be in touch to know, if you have a high temperature, that symptoms of overdose or higher absorption need to be noted. Symptoms of withdrawal can be as well a problem because the patches will not stick. There will be a mix-up between symptoms of higher doses and the drowsy situation or the state of chronic fatigue and tiredness that come with a viral infection. Of course, the pain among all these problems will be completely variable, because if you have higher dose, you may find your pain degree is different, and the same is happening with the withdrawal, or if the patches is not sticking. Now let me speak a little bit about knee pain. So for knee pain, I can categorize this into two types. Some pain come from the muscles and joints, and some pain is coming from the nerves around the knee. So muscles and joints is usually, we call it arthritis of the knee, and this is happening in a population around sometimes from 60 to their 90s. So arthritis, usually, what is the treatment for arthritis? Simple things such as you do exercises, you do strengthening of the muscles around the the quadriceps, which is your thigh muscles. Very, very simple exercises, and actually you can find these exercises on YouTube, or you can ask the physiotherapist about these exercises. So this is the first step in the treatment. Then There are simple stuff as well, such as injections, but as you know, all injections now are on hold. Why? Simply because there is steroid in these injections, and the steroids will depress the immunity. So this is the last thing that we need at this time, where everyone needs the high immune system to fight for the viral infection. Other things as well can be treating the osteoarthritis by having other types of injections. These injections could be plasma-rich platelet, which is completely non-steroidal injection, and could be hyaluronic acid as well. All of these treatments have different category and different response in terms of pain. If these measures did not work, we can actually block or inject the nerves that is around the joint itself. And usually what I do initial injection, which will be ultrasound guided or X-ray guided. If this does work, this is called diagnostic injection. And some patients will not be eligible for actually knee replacement because of the significant other medical conditions. Some patients already had knee replacement surgery, but they are still in pain. So this is probably can only be treated by injecting the nerves around the joints, because the joint is gone and the surgery was done, so nothing else can be done. If initially the diagnostic injection did work, what I do next is to do ablation for these nerves using radio frequency machine, and this is usually does work very well.